Well, the Assembly on Environmental, Occupational, and Public Health has been around the ATS for a very long time. I don't know exactly when it began. And it's a group of clinicians, clinician scientists, and bench scientists, and epidemiologists who are all interested in how the work environment and the ambient environment contribute not only to respiratory health, which is the main focus, but over the years, increasing knowledge about how ambient air pollution contributes to respiratory health has expanded to include its effects, some of which are even more prominent on cardiovascular health, endocrine health with relationships to diabetes, and pediatric and even infant or embryologic effects, embryo-fetal effects of air pollution on health. So we've really expanded a bit beyond the strictly pulmonary concerns because of the great impact of air pollution on health. We also changed our name about 3 years ago. We were the Assembly on Environmental and Occupational Health, and we added population to reflect the great importance of epidemiologic research on how we understand these things and the policy implications of them. Well, it's of relevance because not only is it important from a public health standpoint in its contribution to certain kinds of cancers and other preventable illnesses, but in terms of the practicing pulmonologist, the environment has been and the ambient environment, the occupational environment are recognized increasingly to contribute to the cause or the exacerbation of major pulmonary diseases like adult asthma. And the environment contributes to pediatric asthma, but occupation is estimated to contribute to between 10 and 20% of onset of asthma in adults. So this is something that treating pulmonologists really can't ignore because it not only has prevention implications, but for preventing exacerbations, counseling patients about whether work is a problem and trying to deal with the knotty problem of whether people should change jobs or not and what the economic impacts of that. So if you're going to treat your patients well, it's important to be aware of environmental and occupational factors. The most significant developments have to do with the official recognition that air pollution health effects go way beyond the lungs. There's probably more morbidity and mortality related to cardiovascular effects because there's so much more cardiovascular morbidity and mortality in the population in general. But the recognition that it contributes to embryo-fetal health, which then contributes to later health outcomes in children and then even in adults, the contribution of obesity and other things related to endocrine metabolic interactions. I think those are some of the unrecognized. The recent research hasn't really done a lot more with asthma. We know about that, but we have to get it more in people's practice. I'd say one other thing, which is there's an increasing epidemiologic literature and a smaller mechanistic literature about how one of the greatest contributors to occupational asthma is people who work in the cleaning industry. The people who clean our hotel rooms here at the conference and all have much higher rates of asthma than do people with other kinds of jobs. And so trying to understand how that might happen, whether it's the cleaning products, the waxes, and other things, whether it's an irritant phenomenon or an allergic phenomenon, isn't well elucidated yet. Well, there was just a great presentation on the effects of air pollution on childhood asthma and how those effects are modulated by the obesity status of the kids and their dietary status in terms of vitamin D and omega fatty acids, and how those interact with air pollution to increase or decrease the effects of the air pollution. So that's one aspect. Another is going to be discussions again about indoor air pollution, which is often not recognized as being as important as outdoor air pollution, but we spend 90% of our time indoors. So that's something that's over the years has become increasingly recognized as important.